Now that we have our service treatment records and honorable or under honorable conditions discharge, we can begin the process of filing an initial or new condition claim. These conditions will be direct service related, meaning it was caused or worsened by your time in service. What is an initial VA claim? An initial VA claim is the first application a veteran, service member, or eligible dependent submits to the U.S. Department of Veterans Affairs to request disability compensation, pension, or other benefits related to military service. It established the veteran's eligibility and sets the foundation for determining compensation or entitlements. Direct service connection. Something to keep in mind, the conditions on the first VA claim ever filed will need to be directly caused by your military service, or presumptive due to toxic exposure. For a veteran 6 months or less from discharge, some conditions that they were treated for while still on active duty might be presumptive if it was documented in their service treatment records, showing they were treated while still on active duty. If the veteran files the claim within less than 6 months from discharge, the VA will presume the condition still exists without needing to submit new medical evidence. You will still be required to attend a compensation and pension (CMP) exam. Veterans who were discharged more than 6 months ago will need current medical diagnoses and treatment. It is best to submit that medical evidence along with the claim. If you are unable to get the current medical records from your private doctor, you will need to submit VA Form 21 to 4142 and 21-4142A so VA can request those records from that doctor. If your treatment is through VA healthcare, you will not need to provide those records. What VA evaluates for your claim? Service records to verify military service and eligibility. They will look at your DD Form 214 and other personnel records to verify place and date for toxic exposure presumptive condition claims. They will also look for treatment in service for the condition which you are filing. The VA looks for evidence showing the condition was caused or worsened by military service. VA will look at current treatment records. If the veteran has been out of the military for more than 6 months, current medical diagnosis will need to be submitted. VA needs proof that the condition is chronic. They typically will not accept self-diagnosis. Statements in support of claim. It is good practice to reiterate on the condition you are filing on VA Form 21-4138. This form allows you to describe what caused the condition in service, and how it currently affects your quality of life. You can also ask a fellow service member or close contact such as a spouse, friend, or other family member to make a statement on VA Form 21-10210, describing what they witnessed or how the condition affects you. What exactly are conditions? Here are just a few examples of the many conditions that could have been caused by your service. Bilateral tinnitus. This is ringing in the ears and is caused by noise pollution. VA will use your MOS and duty assignments to presume this condition. Please note, you will need to say this began in service, not afterward. Bilateral hearing loss. Also caused by noise pollution and also will need to have begun in service. Knee strain. Caused by injuries and exposure to climbing, long periods of standing, carrying heavy gear, etc. Be specific in the 21-526EZ. Bilateral is both, or specify left or right on any body part that you have 2 of. Lower lumbar strain, which is a strain of your lower back. This can also be caused by injuries and exposure to climbing, long periods of standing, carrying heavy gear, etc. Anxiety. Caused by witnessing an event, long periods of exposure to stressful situations, a personal attack, failure to adjust to military life, etc. Please keep in mind, there needs to be something in your records showing mental or emotional trauma. If not, you need to have a buddy statement from a fellow service member. A police report will also work. Any mental health condition needs to be accompanied by VA Form 21-0781. Things to note when filing a condition. Be specific. Do not use phrases like, pain in my arm or surgery on my toe. Use words like residuals right arm injury, residuals post left great toe surgery, bilateral tinnitus, GERD, sinusitis, etc. Be as specific as possible. Use medical terms like sprain, carpal tunnel syndrome, residuals broken left ankle bone, etc. Remember, the condition began in service, and it still affects your quality of life. On the next slide, I will note more common initial and new claim conditions. Some common initial and new claim conditions include, but are not limited to, hearing loss and tinnitus from exposure to loud noises such as gunfire, machinery, and artillery during service. Musculoskeletal injuries from injuries during physical training, combat, or accidents. Common examples are back strain, joint strain, or injuries to knees, shoulders, and ankles. Traumatic brain injury caused by blast exposure, falls, or head trauma. Symptoms may include headaches, memory loss, and mood changes. Respiratory conditions like asthma, chronic bronchitis, sinusitis, COPD, or other lung diseases. Often linked to service in areas with poor air quality, such as burn pits, exposure to chemical agents, desert sandstorms, and asbestos. Skin conditions such as rashes, scars, or chronic skin disorders and cancers. Common among veterans exposed to environmental hazards or irritants. PTSD, triggered by traumatic events during service, such as combat, assaults, or witnessing violence. Symptoms include flashbacks, anxiety, and sleep disturbances. Depression and anxiety. This may develop during service or as a result of adjusting to civilian life after discharge. Substance abuse disorders are often secondary to mental health conditions, but can be directly related to stress or trauma experienced in service. Agent Orange-related conditions, burn pit exposure, radiation exposure, and Camp Lejeune water contamination. These are not conditions that you would file on the claim. You will file the conditions such as cancer, diabetes, asthma, Parkinson's disease, etc. due to exposure of the toxin. For example, you will not file a claim for Agent Orange. For more information with associated conditions, please refer to my video for the PACT Act. Hypertension, often linked to stress or other service-related factors. Sleep apnea can be caused or worsened by environmental or physical conditions in service. Gastrointestinal disorders like GERD, which is acid reflux, irritable bowel syndrome or IBS, or other digestive issues. Migraines and chronic headaches are often linked to TBI, stress, or environmental factors during service. These are just some of the many conditions veterans develop due to their military service. If you develop a condition after discharge and you believe it was caused by exposure during service, it can be helpful to locate a medical study from a reliable source and submit that with your claim. Learn more on my video medical and case studies. Total disability unemployability. Compensation at the 100% disability rate. Some other benefits of total disability unemployability include full VA healthcare coverage and dependent education assistance. You must have 60% on one service-connected condition or 40% on one and others, totaling to 70% combined. You are unable to secure or maintain substantially gainful employment due to your service-connected disabilities. You will need to complete VA Form 21-8940 as the initial application. Your previous employers from the past 5 years will need to complete VA Form 21-4192. Temporary 100% rating. This is a short-term rating provided to veterans whose service-connected condition temporarily warrant full compensation at the 100% disability rate. It is awarded when a veteran requires time to recover from surgery, cancer treatment, or immobilization treatment from a service-connected condition. Hospitalization, surgery, cancer treatment, or immobilization for a service-connected disability requiring at least 1 month of recovery. You will use VA Form 21-526EZ to apply for this. Please note, you must apply for this. VA will not just automatically award it to you. Complete the entire form as normal. When you reach page 11, list the service-connected condition, procedure, request temporary 100%, and the date the procedure occurred or began. Do not forget to sign and date the application. Submit this along with something from your doctor, describing your expected recovery time. What form should I use? 21-526EZ is used for initial, new, secondary, and request increase claims. 21P-527EZ is a claim for veteran pension. This is available to wartime veterans who have little to no income or have medical care costs that leave not enough income left to survive. The veteran must be unable to work because of non-service-connected disabilities. Please see more on requirements in my video Pension and DIC. 21-534EZ is an application for DIC, death pension, or accrued benefits for a qualified surviving spouse or dependent child. 21-0781 is a statement in support of PTSD, MST, and all other mental health conditions. 21-4138 is a statement in support of claim. Use this to add more detail on the conditions you are claiming. You may also use this form to make communication to VA regarding any other issue as well. This is a communication for any means of communication you need VA to be aware of. 21-10210 is a statement from a fellow service member or other close contact to support your claim. 21-4142 and 4142 is a medical release for. This allows VA to request treatment records from your private doctor. 21-2680 or 21-0779 if in a nursing home. This is an application for examination for housebound status or permanent need for regular aid and attendance, used for a veteran or qualifying surviving dependent who needs assistance with dressing, bathing, feeding themselves, toileting, or medication management. This is a special monthly compensation or pension. For detailed information on how to properly complete these forms, please watch my video. Forms.